Hello, my name is Brianna Newton, and today I'm going to be presenting the female reproductive system. In particular, the organ that I chose to become an expert on for this presentation was the uterus. As you can see, it is drawn out in my picture of the female reproductive system. In particular, the uterus is this pink section. The exact location of the uterus varies by individual and with the bladder. In the average female, the uterus is anteverted to the vagina and anteflex to the cervix. Anteverted means that it is rotated forward towards the anterior surface of the body, while anteflex means that it is flexed towards the anterior surface of the body. Normally, the uterus lies immediately to the posterior superior to the bladder and anterior to the rectum. The uterus sits in an inverted position in the pelvic cavity. It is along the body's midline. Superior to the body is a region known as the fundus of the uterus, which is also drawn on the top portion. The uterus is a thick-walled muscular organ with capability of expansion to grow a fetus. So when a woman becomes pregnant, it all can expand in order to fit a fetus inside of there. The uterus is distally connected to the vagina and laterally connected to the uterine tubes. Excuse me. So here I have them labeled as the fallopian tubes, but they're also known as the uterine tubes. And then here is the cervix, like I said, the uterus, and then the uterine cavity and the vagina. The uterus consists of three parts. The fundus, which I mentioned on top, is at the top of the uterus and the entry point for the uterine tubes. The body is the usual site for blastocyst implantation, and the cervix is the lower position that links it with the vagina. The cervix is structurally and functionally different than the rest of the uterus. Three tissue layers make up the wall of the uterus. The perimetrium is the outermost layer that creates the skin of the uterus. The uterus is a serous membrane which continues with the peritoneum that covers many organs in the abdominal cavity. This layer protects the uterus from friction by the smooth layer of simple squamous epithelium and through the secretion of watery serous fluid and to lubricate the surface. Deep in the in the perimetrium is the myometrium. The myometrium forms the middle layer and contains layers of visceral muscle tissue. Throughout pregnancy, the myometrium allows the uterus to expand and then contract during childbirth. So I have the myometrium labeled right here, as you can see. In the myometrium, there's a layer called endometrium. The endometrium layer borders the lumen of the uterus. The endometrium is made of simple columnar epithelial tissue with associated exocrine glands. It is also made up of highly vascular connective tissue which supports the developing embryo and fetus during pregnancy. The uterine epithelium has three different kinds of cells: secretory cells, cells of cilia, and basal cells. The uterus functions to nurture the fertilized ovum, which becomes a fetus, until birth. The uterus provides structure to support the bladder, bowel, pelvic, bones, and organs. The uterus also separates the bladder and the bowels. The blood vessels in the uterus direct blood flow to the pelvis, ovaries, vagina, labia, and clitoris for sexual stimulation response. Something I didn't know prior to this research is that the uterus is needed for uterine orgasm to occur. So if a woman has a hysterectomy done, they can no longer have a uterine orgasm. The vagina maintains normal bacteria amounts to keep the reproductive system at a homeostatic level. A positive feedback loop occurs within the cervix and uterus during childbirth. The female reproductive system maintains homeostasis by keeping pH levels below 4.5. If these levels are not maintained, the body can gain an infection. One particular problem that can occur if the homeostasis is unbalanced is bacterial vaginosis. Bacterial vaginosis is inflammation that happens in the vagina from bacterial overgrowth. This creates pH change and breaks the homeostatic levels. So one disease that I chose to talk about that can occur in the female reproductive system is one that really hits home for me, and it's called endometriosis, which I was diagnosed with 3 years ago. There's a lot of unknown information when it comes to endometriosis, so I'm going to try and break it down and make it a little easier to explain or to understand. Endometriosis is a common gynecological condition. As a matter of fact, 1 in 10 women across the world have endometriosis, whether they have been diagnosed or not. The name of this condition comes from the word endometrium, which is that tissue that lines the uterus that I talked about earlier. During a woman's regular menstrual cycle, the endometrium tissues build up and shed if she does not become pregnant. But with endometriosis, that tissue grows onto other portions of the body, and instead of shedding out the vagina, it turns into scar tissue. It can be found in all parts of the body. Some people think mainly only in the pelvic cavity, but it can be found in the brain, the diaphragm, the intestines, you name it, it can be found there. I've even seen cases of it found on the heart. A lot of women go undiagnosed with endometriosis, and the average year, I believe, is about 10 years before true diagnosis or correct diagnosis. The only way to actually diagnose endometriosis is through laparoscopic surgery. Some people may believe that it can be diagnosed through CT scans or x-rays or other ways, but the only official way to see endometriosis tissue is through a laparoscopic procedure. The causes of endometriosis are still unknown. Some people think that it's from how the tissue breaks up and has reverse menstruation and attaches as it grows. Some people think it happens when you're born and the cells just do not grow correctly and make their way down to the uterus, so they kind of stick and remain dormant until the years of puberty, and then it shows up. But it's still unknown, and it's unknown if it's hereditary. It can, like I said, it can occur all over the ovaries, the ligaments, the outer surface of the uterus, pelvic cavity, intestines, rectum, bladder, vagina, cervix, diaphragm, lungs, heart, brain. It can occur all over the body. Some people think that endometriosis, your risk factors go up if it is in your family, but that is also unknown. Some symptoms of endometriosis are pain. Sometimes excessive menstrual cramps would be a way that some people describe it. Other women say that there is no definitive way to describe the amount of pain that endometriosis brings. It can bring pain with intercourse, abnormal or heavy menstrual flow, infertility, pain with urination or during menstrual periods, painful bowel movements, especially during menstrual periods, and other GI problems. So with that being said, if you've never heard of endometriosis, I highly suggest looking into it, especially if you're a woman, because like I said, a lot of women have never been diagnosed with it, but they could have endometriosis. For a relationship to another system, in Bio 201, I did the nervous system, and for my final presentation, with a focus on the brain. In the female reproductive system, the nervous system controls a few different things. In particular, the nervous system controls the vaginal secretion production, orgasmic contraction of your uterus, vagina, and sphincters, your uterus, cervix, and vagina. Sensation that is transmitted from your genitals to your brain is also controlled by the nervous system. These are all controlled by different portions of the spinal nerves, the spinal cord, the sympathetic nerves, the parasympathetic nerves. For instance, the vaginal secretion production is controlled by the parasympathetic nerves from the S2, 3, and 4 levels of your spinal cord. The orgasmic contractions are controlled by spinal nerves from the S2 and 4 levels of your spinal cord. Your uterus, cervix, and vagina as a whole are controlled by the sympathetic nerves from the TL and L2 levels of your spinal cord. And then the sensations that are transmitted from your genitals to your brain are usually controlled by the spinal nerves of the S2 and S4 levels of your spinal cord. Sorry, it's storming outside. But the reflexes from sexual function of females and their reproductive system are also controlled by the nervous system. So in whole, the female reproductive system is mainly controlled and reacts based on the nervous system. Thank you for watching.